Jones, Healthcare Marketing Communications. Thank you for joining us here. For those of you on Zoom, welcome. And I know Katie has us restreaming on YouTube and Facebook, as well as I think LinkedIn. So for those of you watching us on a streaming platform, hello, good morning, good afternoon. We have a number of folks across the country. So thank you all for making time with us today. I'll get to the topic in a second, just a couple housekeeping thoughts and notes. So this is being recorded on Tuesday, April 20th. For those of you that are watching this on demand in the future, I doubt that many of the policies or things that we're talking about are going to change significantly. This isn't like our lobbying and advocacy conversations that we've been having. Things aren't expected to really change that abruptly or that often. But I thought I'd mention that, to put some context to the things we're talking about. Also, would like to try to make this as interactive as possible. For those of you on Zoom, please just put a couple questions, notes in the chat. In particular, if there's anything that's relevant to your organization or the broader conversation, would love to hear it. And for those of you on social media, please put some comments and notes in the chat. Katie will try to keep an eye on those and throw those to me here as the moderator. So what we're talking about today is also based on our book, Under the Influence, and speaks a lot about healthcare marketing strategies and puts a lot of what we're doing in the context of the consumer and our communities. Book is free. I think many of you that registered put your address in, but if you'd like one, please either send us a quick note or even just put your note. You can send a private chat for those of you on Zoom, and we'd be happy to send one out to you. A lot of good stuff here. And something we wanted to produce for the greater good. So thank you all for joining us. I'm going to share screen now and kind of go through entering full screen. Okay, we're off and running. So again, thank you for tuning in. Today's topic, how to treat healthcare consumers, understanding generational differences. And this topic in particular, is literally lifted out of the first chapter of our book. And we thought it was important not only to start the book with this, really understanding and tailoring and segmenting our audiences, both for service line, for our institutional brands, and really thought it was important to start before we even got into tactics and other things that we cover in the book. Thought it was important to start with this context. So we're glad you're here. And again, hoping to tailor this to you. If you have any particular questions, again, put notes and thoughts in the chat. We have a pretty diverse audience that's not only streaming, but here on Zoom. Urban, suburban, rural, large organizations, small. We're trying to make this as relevant as possible, not expecting everyone to have the same or even sometimes any resources to implement some of these concepts, but we'll try to make this as relevant as possible. And I will advance. So really what we're talking about is an understanding, a deeper understanding into consumers. And they've changed a lot, certainly in my lifetime. I'm 53 years old. Never perhaps more rapidly than with the advent of the internet in particular. There was a lot of consumerism. Things like WebMD gave birth to a lot of empowerment. And now through social media and broader networks, consumers have changed faster than I think many of us have expected. And in particular, how we communicate with them and segment those audiences is important. And we'll talk about that. That's the focus of our conversation. And again, it's the first chapter, first section of our book, Under the Influence. Mark Shipley had originally written the book. Lisa Barone, myself, and my colleague Sharon Lawless, the three of us, as well as Katie Soros. Oh, I'm sorry, Katie, I've done this again. I keep pulling the old template and I keep forgetting to give you credit for a lot of the content that you're producing. So enough about my colleagues on screen. Let's talk about Katie for a second. Katie's been developing a lot of really great content for us on social media, contributing to our trends report, and the whole team. We're trying to keep things as current and relevant as possible, and in particular, some of the challenges within the last year. So just a quick acknowledgement to my friends out there. So let me start and let me talk about these generational differences with this in mind. So pretend for a second you're going to a party, and like many of us, if you find yourself in a larger party, it's very normal human nature to kind of make assumptions based on the people there. If this party is in my hometown and there are people there that look like me, that dress like me, that act like me, that look like me, it's very easy, I think, to assume we have the same set of values and opinions, and certainly make assumptions. Now, that's not the most tactful thing to do, but it's human nature, and I think we do it. But my point is, I think we can do better, and we should do better, not looking at people as a whole and making a certain set of assumptions. It's something we try to do and when we're in these social settings, but yet we forget to bring it into the marketing conference rooms as we're developing our plans. And if we don't do this, we could find ourselves like Kylie Jenner and Pepsi. For those of you that don't remember, a couple years ago, Pepsi launched this campaign, and we were at some sort of rally. The setting for the commercial was at some sort of rally. It could be women's rights, it could be Black Lives Matter. We really weren't quite sure. But in comes Kylie Jenner, and she really just sort of saves the day. She's positioned by Pepsi as the hero, offering the police officers a Pepsi. And they were really criticized. I mean, I think the term tone deaf really didn't capture it enough. They pulled the spot, they apologized profusely. And the point was, they just simply didn't understand their audience. They didn't understand the needs and wants of their audience. And they just simply thought about telling a story that might be relevant to something happening around them. And I bring this up because this is a great example of certainly marketing blunders, but in particular, the fact that we have to do better as marketers as we think about our audiences. And that's what we'll talk about today. So again, and I won't read a lot of this, and much of what I'm talking about here is in our book. So again, we can save this or send this to you. Feel free to screenshot or whatever else you might need to do. But basically, my point is, we don't want to stereotype. We don't want to put people into a box. We don't want to make sets of assumptions. We need to do a better job getting to know our customers so that we can tailor our messages, so we can find the right media tactics and be much more efficient reaching them. Now, look, I understand many of us are with marketing departments that simply have only one or two people. Building out a marketing segmentation chart can be very, very difficult. Easier on social media, certainly different when we go into different service lines that might appeal to different demographics. But certainly something that is important and something we should try to do wherever possible. Obviously, bigger teams have more resources, the ability to segment messaging. But I think in general, the point I want to get across is that we do need to do a better job getting to know our customers and thinking about this as we tailor communications. So as we go through today's presentation, think about your organization, think about the audience you're trying to reach with hospice care. Think about the audience you might be trying to reach with your labor and delivery unit. Think about the audience you might be trying to reach with sports injuries, and when it comes time to develop those messages, those might be places where it's much easier to segment these audiences, to develop and tailor messages, as well as the media tactics. So thinking about that, maybe a good way to make it practical in terms of how it's implemented. First, let's chat a little bit about the factors that influence healthcare consumerism. So as I mentioned before, there have been a lot of rapid changes, and it's certainly no longer enough to deliver good quality healthcare to be competitive. In fact, very often, I hear from patients when we get into focus groups that you better have the best and brightest staff, you better have the most caring nurses, you better have the latest technology. Those things, when I asked about and asked the focus group participants to compare one hospital or health system to another, those are things that almost never come up. I have to probe for those. Everything that happens or everything that they volunteer, the unaided information, is typically around customer service types of topics. And I think that's important. I think there's an assumption now that you better have these. That's the cost of doing business. I will really define my experience based on how you've done with all these other things. Certainly, and we'll talk about this theme in general, healthcare consumers have gotten a lot more savvy, especially the younger they get. They're more concerned with brand reputation, patient experience, as I described a moment ago, and that seems to trump physician referrals. Now, again, it's different. I'm not going to make assumptions about all of them, but one of the themes you'll hear today, with differences pointing out for demographic audiences, are these sort of trends. And again, how you can communicate your competitive position, deliver that desired experience to connect with those generations is what we'll talk about. So what are the factors that influence that consumerism? Well, we talked earlier about, or I mentioned briefly, online information access. So WebMD was the first biggest, best example. At first, many physicians were resisting it. I went to medical school. How dare you type in symptoms and bring a printout? But I think certainly over the last decade or more, they've come to embrace that. It actually becomes a point of efficiency. You've already typed in or told the computer what you think your symptoms or issues are. Now let's use that information to find the best solution, not necessarily the one that WebMD mentions. Hospital metrics, Leapfrog, a lot of other programs are out there. Those kinds of measurements, physician reviews are available out there as well. Consumers are shopping based on quality outcomes. They're certainly turning to, not only their friends and family who have been traditional referral sources, but we have massive social networks that are extremely active and much faster to access. In fact, very often, and we'll talk about this, you'll see Facebook recommendation requests. Anybody know a plumber in my area? Anybody know a physician they would recommend? I think another thing fueling consumerism, alternatives. So it's not always just about going to the hospital, but they can go to freestanding specialty clinics and enjoy the convenience, comfort, cost savings. They do have alternatives. We're no longer just going to the hospital. And even financial responsibility. Not as easy to find in terms of rate card, but institutions do get a reputation for cost. And whether that's just out of pocket or copay or perceived value for the cost, they are shopping more and more based on these issues. So these are just a few of the factors, and I think it's important to know what's fueling the perceptions as we dive a little bit deeper into each of the demographics. Again, building on this, I think each generation that we'll talk about has those unique emotions and triggers and motivators that help, building on their sources of information. And this is what we're going to cover as I kind of move forward into the next section. So that's a lot to unpack. Let's break that down generation by generation. And let's start in the middle. And I'll back up in a second and kind of go through in something that's a little more chronological order. But I thought it was important to start with what's being called the sandwich generation. So by definition, loosely, depending on who you listen to, or I guess today you're listening to me, these are adults in their 40s to maybe about 60 years old. And in many ways, we see them as probably the most powerful healthcare consumer group. And why is that? Well, these folks are not only working upward, caring for aging parents, but at the same time, they're reaching downward to care for their children. Now, whether these are folks that are technically under the age of 18 or college-age children that are still dependents. And depending on that, they certainly fall into a couple different categories, Gen X, baby boomers, et cetera. Most of the people that fit into this criteria that are caring for people older and at the same time younger, about 75 or 71% of those fall into those two different categories, Gen X and baby boomers in particular. But given their reach, this is part of the reason why we consider them to be one of the most powerful healthcare consumer groups. They're certainly the busiest, and we'll talk about that in a second, but they have influence over multiple generations, quite obviously. So they're providing financial support, caregiving, emotional support to not only parents and children, as we talked about. They don't see this necessarily as a burden. They're not looking at this as something that they're doing, grudgingly, with obvious exceptions, but rather many of them look at it as an opportunity to provide important care, but also develop stronger relationships with their families. Now, given how busy they are and the physical demands of busy households, especially when you add in healthcare and if you're working on parents who are particularly ill or dealing with certain treatments, things can get very busy. And in particular, they're looking to simplify their life wherever possible. Key messaging point that we'll talk about. They're certainly educated and well-informed and feel a sense of empowerment, though it may not be clear to them that they are in this sandwich generation or that they have the influence that they do, but they're also active researchers. Like many of us, they're at a loss when it comes to filling out paperwork and navigating healthcare systems and processes, especially when it comes to working with their parents, having proxies and all those kind of things. And very likely they're shopping around for the best value to, expensive interactions. Which brings us to the next slide. From a financial standpoint, among those adults who financially support at the same time a parent and child, only a few percent of them, 28%, say that they live comfortably. 30% say that they meet their basic expenses with just a little bit left over at the end of each month for savings or discretionary spending. 30% say they have nothing left over at the end of the month. Share a little bit about them, but in particular wrap up each section with tips for reaching them, whether it's tactics or messaging, again, at the very headline level. So as I mentioned, they're very busy. And what does that mean? Well, digital marketing certainly makes a lot of sense. Social media influence, because they are likely to be researching your Google search would be, tactics that we would recommend. Interesting for this age, for this demographic, TV is one of the most effective media in terms of conversions that we've seen. And by that, we mean conversion from inquiry into appointment intake of some sort. News products, and especially TV news, this is something that if you've been attending some of our webinars over quite literally the last 12 months, we've been advocating and directing clients to shift a lot of their spend into news products. Now that could be your regional paper's website, it could be the local 6 o'clock news with your NBC affiliate. Point being, over the last year, we've had just an unbelievable amount of change in our society, certainly with COVID, with Black Lives Matter, with the trials, with the election. The virus is the economy, and we're all wondering what's happening with vaccination. People are consuming news like never before. Now, if it weren't for the pause in a lot of retail and restaurant spending, a key revenue source for news, the news, stocks as well as revenue would be off the charts. So at a time when people are consuming the most, they're challenged with making their own revenue. But point being, if you want to reach them, this is, one of the things that we would recommend significantly. So moving, and again, I wanted to start in the middle with the sandwich generation, but let's take a step back and look at that greatest generation. These are 48 million people, technically born before 1945. They make up about 12% of the population, but account for 35% of hospital stays, 38% of emergency medical care. They require more frequent and longer patient visits. They expect a high level of service. They're very, well, we'll talk about their perspectives here on this next slide. They tend to cling to those past and traditional doctor-patient roles. These are folks that grew up long before the internet, long before this 24-hour news cycle, and their generation grew up with doctor knows best. Very often, and many of you have heard me say this, we put patients on a spectrum of empowerment. On one end are the fix-me's. You went to medical school, I didn't, here's my symptoms, tell me what to do. And I think that's where this generation falls into. On the other end of the spectrum, is a much more empowered patient, strong-willed. I used to call them Murphy Browns when that was a relevant example for anybody that remembers that show. I've got to find a newer model. Somebody put that in the chat for me. Who is that character that is that strong-willed, take charge personality, in particular with healthcare? The reason I mentioned Murphy Brown is she was becoming a single mother, I think, at the time, if I remember the context of that. So anyway, a number of those perspectives. And so These folks are following doctors' recommendations for medical care direction and information and referrals. But their children's, these boomers and Gen Xers, may be influencing or making even some of these decisions for them. They're not as likely to research health options online or participate in online communities. Unlike even boomer generations just after them, they may not even be on social media as much. We hear that is and continues to be one of the faster growing segments. Grandparents keeping up with what's happening with their grandkids, but this group tends to fall outside of that still. So when they're selecting a hospital health system, they're going to be influenced, almost wholesale by where their doctor suggests they go or where they've had prior experiences, followed by hospital reputation, or then proximity, making decisions based on convenience. And this is something that we've seen for decades as well. And just go into the next slide. You'll see this chart also in terms of the importance of sources of information based on the survey. And I have the bibliography at the end, the citing sources. But this greatest generation, factors for hospital selection, strongest based on physician recommendations, prior experiences, and hospital reputation. And I'll point out some of the differences in this as we go through and talking about some other generations as well. So reaching them, certainly physician referral initiatives. This is great for signage, things in the office environment, certainly mass reach, print media, television news, all of that makes a lot of sense. I wouldn't put a lot of dollars into digital. So referring physicians, probably the best way to reach them, working through your physician relations office. But as this population ages and declines, hospitals are hiring more doctors, this strategy, promises diminishing returns. Customer experience, communicating patient experiences, testimonials, especially when your staff and physicians are aligned, and we talk about this quite often, living the brand promise, I think is especially important. And because of the importance of reputation, they're certainly responding to reputation claims. Again, as I mentioned before, open to mass media such as print and TV, as well as in-office signage, table tents, those kinds of things. So then we move on to baby boomers. And this is a group, roughly 77 million folks, born between 1945 and 1965. I just missed it. So roughly 80 million, what our author is calling this silver tsunami, growing population of seniors, that's kind of changing the expectations of the healthcare industry. If you think about folks that grew up in that time period, significantly more empowered, they looked at society different, they were able to create societal change, and that certainly changed their mindset for that entire generation. Questioning that status quo, searching for new solutions, likely to be directing their own healthcare, but still also serving to care as caregivers and advocates for both their parents and even for their Gen X kids as well. So like the generation before them, they're influenced by physicians, but they research their options, probably online. They're challenging assumptions and rely on a lot of conversations to make those choices. Sometimes that's with a physician, but a lot of times that's also their offline as well as even online social networks. They value quality. They're influenced by reviews and rating systems when choosing care providers and specialists. So as we look at the chart for this group in particular, the baby boomers, now we're not seeing that same shape. Yes, they're influenced by physician recommendations, prior experiences grows a bit more, and here hospital reputation grows a little bit more. Advanced technology bumped up, about 7 or so percentage points as well. And again, we'll send this to everybody that had registered, and all of this is in our book. So reaching baby boomers, referral initiatives. Again, they're also relying on doctors for recommendations like the generation before them. So marketing to and with your referring physicians can be effective. Integrated online and offline messaging that drives to web. They're very likely to seek information online to the extent that you have the content or the information that they're looking for. This is a group that grew up offline, worked a little bit to embrace online media. So the notion that you could have a multifaceted, integrated campaign, traditional and digital media, pushing to your website as a source of information, or those conversions for things like booking appointments or more information about treatment protocols or things like that. Reputation building and management, again, this is important. They consider that. For these audience segments, this is where, and we often get the question, gosh, should I pay X amount for whatever the rating, survey rating or scoring, could be, and the ability to use their logo, whether it's Leapfrog or US News or something else. For these audiences, and in particular the service lines that support them, it actually may make a lot of sense. Customer experience, and again, this is, appeals to baby boomers, both as patients as well as the caregivers for their older and younger generations. You'll hear us say this quite often, important to align internal staff to deliver consistently positive experiences. And I think you'll hear this in some of our next few audience segments. These are the opportunities, these are the audiences that are very demanding from a consumer standpoint. They have a drive-through, now DoorDash sort of mentality. I can, and actually just recently did, order something from Target at noon, which was at my house an hour and a half later. We have a drive-through instant delivery mentality. Amazon can get me anything I need on the planet within 2 days. And it all had better be great, seamless return policies and everything else. So when they step into your institution, and we talk about this very often, the cleanliness, the customer service, the way that they're greeted, everywhere else in their life, they're bringing that into your admission staff and challenging them to deliver that same type of experience, which will foster that kind of loyalty. So Generation X, these are my folks. This was Paul Fahey class of 1986. So first generation of true healthcare consumers. They're in their, sorry, I think I've got a typo here, but because I'm not in my 30s and 40s, but they were born from 65 to 85, so they're in their 40s and 50s. Cold War, dot-com bubble, first true healthcare consumers. They have an affinity for brands. They're going to seek out information. Their short-term expectation of provider relationships will change. They'll switch based on experiences. They don't have the depth of loyalty, and they do have mobility that older generations don't necessarily express. So again, here, when you look at what factors influence their selection of a hospital or health system, physician recommendations still play. Prior experiences now have a greater importance. Hospital reputation now is the key driver for this. Proximity and location, advanced technology drops off pretty significantly. They'll travel and they assume, like on most generations, that you've got advanced technology. So reaching them, again, some of the common themes you'll hear us talk about, but integrated offline and online messaging that drives to web, reputation building and management, anything that can start to quantify that. Customer experience certainly is important, as well as those physician referral initiatives. And the last group that I'll cover in this part of the conversation are millennials. So we've got about 72, 75 million of them, born since 1982, somewhere in the early to mid 80s. These are now 25 to 40-year-olds. Who, because of their youth and their general health as a category, have low utilization of inpatient and outpatient services other than emergency visits and maternity, labor and delivery. These are digital natives. They grew up with the internet. They know nothing else. They shop for healthcare. They're likely to switch providers. They're influenced by reputation and advertising, perhaps even more so than some other categories. They're going to seek information from not only online search and reviews and rating sites, but they have the largest social networks of anyone. Their ability to ask and quickly understand what an organization's reputation is about, or asking their network for referrals, is more robust than other categories. Again, they value personal relationships with care providers, but they're likely to switch hospitals and health systems if they have a negative experience. They don't have, probably have the least set of loyalties with health systems than others. Now, we all know, and one of the things we've talked about before on this series, those key drivers for relationship building, certainly one of the top ones is labor and delivery. If the young family has a positive experience in labor and delivery, you're more likely, and if they remain in that community, you're more likely to retain them, for a lifetime as they go into other key drivers such as cardiac and cancer. From our experience, those seem to be the three service lines that have the halo effect to the rest. How well you do and rank in those, really drives the perception of the brand. Now, in particular, with millennials being younger, maternity is the only opportunity to start to build those relationships and with the family. So here again, you'll see hospital reputation and a bit about prior experience are those factors. They're going to select based on reputation, and they're going to remain and be loyal based on prior experiences. Proximity and location matters very little, and advanced technology rates probably the lowest among any. They're not going to ignore physician recommendations, but it's not a key driver overall for their hospital selection criteria. Reaching them, again, integrated online and offline media, although I would push most of our spending into mobile marketing, e-health apps, anything that supports a digital lifestyle, and in particular, social media. Again, reputation building and customer experience. I think this group will certainly respond to campaigns that build around those key messages. So a few summary thoughts as I'm coming to the end, and I see we had a couple questions, one that I'll address in a second. Again, when I go back to the beginning of our presentation, the example that I gave about sort of walking into a group and seeing a bit of sameness and thinking that they're all the same was sort of what I was trying to do or describe about a community. You understand your community is much more diverse, but as we start to break them down and understand those generational differences, that greatest generation before 45, baby boomers 45 to 85, boomers 45 to 65, Generation X 65 to 85, and millennials born after those early to mid 80s. Thinking about them, thinking about the service lines, and knowing what's important to those. I hope you'll reference not only this presentation, but even sometimes the charts, as we're developing a service line for labor and delivery, or if we're developing a service line for hospice care, or anything that might be related to, cancers that affect older populations, whatever it could be. Understanding those differences are going to help us be much more relevant and in tune with their needs and wants, and make us more relevant in their lives. So a few parting thoughts. I mentioned technology, and it got an unfair play, I think, earlier on. So I did want to make a mention, and one of the things we cover in this chapter is that technology does matter for specialty hospitals. As you saw before, the scores were pretty low in terms of how influential technology was. But when choosing a specialty hospital, now it goes up, pretty significantly, as an influencer when choosing, a specialty hospital. Overall, I think location has very little impact in hospital selection, with the exception of the greatest generation, maybe a few boomers, depending on how old they are. Those folks will and always have made decisions based on proximity. For them, that equates to convenience. Anything else, you're certainly your Gen Xers and millennials are all, more mobile, more active, and more likely to switch based on an unpleasant experience. So pricing, as I mentioned before, is playing a role in healthcare decisions. Certainly folks are thinking about, especially if they have higher deductibles or copay or out-of-pocket costs for particular things. The tool to combat that is reputation messaging. You want to attract the most profitable patients, but consumers are looking for a way to be able to pay for the best quality care. And when your competitors are competing on price, we see that, other organizations are well positioned to take market share from those in the middle, whether it's, competing on price, whether they're high end or low end providers. I think the sweet spot from a market share perspective would be right there in the middle. Certainly online information is, and we talked about this at the very beginning, fueling that free choice. Proliferation of online information resources, the review sites like the ones you see here, Google reviews, Yelp, Facebook, Facebook recommendations, these are the fastest way to get what was once word of mouth referrals. Maybe we can call them word of click, referrals. And the ability to self-diagnose, find information online with a few keywords, looking at the ratings, asking for referrals, all of this takes mere moments and can really sway. I don't think many of our clients are doing enough. I think most organizations in general don't do enough on review management. Quite often we're just don't have the resources to be everywhere. We need to get out the information on a particular service line. But then, these are the kind of things that would be nice. And my point is I want to encourage us collectively to be paying more attention to these tactics. A couple notables, and again, I'll share this with folks that registered, or if you're watching this live stream, put your email in the comments or whatever. Not only will we send you your own copy of the book, Under the Influence, but also you won't have to screenshot, or you can just screenshot this. But some of the things that were gleaned from the surveys that we were citing in this in our book, I think would be very important for our media buyers to know. If you're looking at day parts and particular service lines, when they consume content, the time of day, the types of tools that they're using, their attention span, in general, looking at, shorter attention span, the type of content that Gen Xers are looking for, relates to blog articles, images, comments, ebooks, but other audiences don't have that. Looking at popular times to consume either online content or other things. I think this is really interesting slide. And again, the kind of thing that you should share with your media buyer, or if you're the media buyer, keeping this in mind. Very often, and you've heard us say this, I don't like the off-the-shelf media packages that we're often given by our sales reps. They have to fill 24 hours sometimes of content, and yet sometimes I only want morning drive. Or in this case, if I'm trying to reach a Gen X audience with a particular service line, can I get my online message out there at 8 p.m. or whatever else I can do, just so I know when they're consuming some of this information. So final thought, and I hope this has been helpful for you to see, not only your hospital, your institution through consumers' eyes. As I mentioned at the beginning, the healthcare field is changing rapidly in terms of this shift from, the traditional patient physician relationship that we talked about, that the greatest generation still holds. But the younger generations have become a lot more empowered and are spending a lot more time. There has been that shift of control, quite frankly, out of the physician's hands, out of the hospital's hands. And one of the things that I think is interesting, and many of you do this, but just typing in your institution's name or service line into something like Google or a review site, just to see what people are saying, I think that can be very, very helpful. Just to get a sense of what you're working with. If it looks good so far, maybe you've got that covered. But I think in general, we do need to tune into that changing consumer model and pay attention to not only the generational differences in needs, but also, what's happening in the context around us, as I mentioned, over the course of the last year or so. And exhale. I got to get another panelist on here. It takes some stamina to keep going. So thank you for staying with me this long on behalf of our writers. And I did want to take a quick look because I think I had a chat that was, or a question that was in the Zoom chat as well. So let me just see, here it is. Greatest generation, yes. Carrie, you had a question about just clarifying, and I hope I did it toward the end when I summarized the age differences of greatest generation. Yes, is more like, you know, in their 80s or so. And let me just check, see if Katie had sent me anything here from our online comments, which I might be able to answer here in real time. So just bear with me for 1 second as I go back to stopping screen share. I think I'm good. So I think I've captured all the questions in real time, but again, if there's anything else that's on your mind, we'll follow up with everybody who registered on Zoom. Please put your questions, if you're watching this restream now on Facebook or YouTube or LinkedIn, you know, put your questions in, we'll try to answer those offline as well. So thank you for joining us. I hope you found this of interest. We're going to be doing another in the series later in May, topic I think to be announced, or Katie will remind me that we already picked it or whatever, but I look forward to seeing you again, and I hope this has been helpful. So enjoy the rest of your day, everyone. Thank you very much.